Hello, my name is Dr. Alexandra Berger, and I'm a board-certified urologist in the Brigham and Women's Men's Health Center. In this video, I will be discussing the most important things you need to know about the vasectomy procedure. Vasectomy is a permanent form of birth control or contraception. While the procedure can be reversed surgically in some cases, this does not have a 100% chance of success. In the case of a patient who wishes to conceive after vasectomy, they can opt to either have the procedure reversed surgically or to have sperm surgically extracted from the testicle for use with in vitro fertilization. But again, neither of these options have a 100% chance of being successful. Some patients also may wish to pay to bank sperm prior to the vasectomy to preserve fertility. It is important to note that in general, these options are not covered by insurance and can be expensive. Because of this, vasectomy is a good option for men who do not desire to have any children in the future. In the Brigham and Women's Men's Health Center, one of our surgeons who are board-certified, fellowship-trained urologists with years of experience performing minimally invasive vasectomy will be performing your procedure. Most vasectomies are performed in the office under local anesthesia, which means numbing medication is injected into the scrotum and no sedation is used. Some vasectomies are performed in the operating room under sedation if this is preferred by the patient or deemed necessary by the surgeon for anatomic or other reasons. How does a vasectomy prevent pregnancy? It is important to first understand the anatomy. The vas deferens are two tubes, one for each testicle, that carry the sperm to be ejaculated out of the body. During a vasectomy, these tubes are cut and blocked. Because they are cut and blocked, sperm can no longer exit the body through the vas deferens. It is also important to know that patients still ejaculate after a vasectomy, but that the semen will not contain sperm as long as the procedure is successful. What happens during a vasectomy procedure? The patient is asked to lie on their back, and then lidocaine or numbing medication is injected with a small needle into the scrotum. The surgeon will then make a small opening or cut into the front of the scrotum with a special tool that minimizes bleeding. This is known as a minimally invasive or scalpelless technique. The vas deferens are then cut and burned with cautery. A dissolvable stitch and a small titanium metal clip are placed between the cut ends of the vas deferens to prevent bleeding and to ensure the ends do not grow back together. The skin is then closed with dissolvable stitches. In general, the procedure takes around 20 minutes to perform. How should I prepare for my vasectomy? We recommend that you shave or trim the hair on the front part of the scrotum under the penis. You should stop taking aspirin, ibuprofen, or other non-steroidal anti-inflammatories 1 week prior to the procedure. Talk to your doctor if you are on a blood thinner, as this will also need to be held prior to the procedure. Your doctor may offer you a pill to help with anxiety related to the procedure. If so, you should take this 1 hour prior to your procedure time. You should plan to have a ride to and from the procedure. If the vasectomy is being done without sedation in the clinic, please remember to eat and drink before your appointment to prevent yourself from feeling nauseated or dizzy. If you will be having sedation, the preoperative clinic will speak with you to let you know when to stop eating or drinking prior to the procedure. What is the recovery like after a vasectomy? As far as pain goes, you should expect minor pain, bruising, and swelling for several days, which will normally resolve within 1 to 2 weeks after the procedure. You should ice the scrotum for 15 minutes on, 15 minutes off for several hours after your procedure, and then as needed for comfort after. Take Tylenol and or ibuprofen if you're able to, around the clock for the first few days, and then take these as needed. No prescription pain medications are necessary after a vasectomy. As far as activity restrictions go, the day of the procedure, take it easy. Walk only within your house and don't run errands or go for a walk. This will significantly reduce the amount of swelling and bruising that you have. The next day, you can walk like normal and return to desk work. However, we recommend no heavy lifting of more than 15 pounds, no exercise of any kind, no bike riding, and no sexual activity for 1 week after the procedure. During this time, you should also wear supportive underwear, such as boxer briefs or briefs. You may shower immediately after the procedure, but do not submerge in a pool, hot tub, or bath for 1 week after the procedure or until your stitches dissolve fully. When should I contact my surgeon after my procedure? You should reach out to us if you experience increasing pain or swelling in the scrotum, a large or expanding black and blue area or a growing lump, a fever of more than 101.5, or increasing redness or drainage of the incision. How will you know if the procedure worked? You will not be sterile for at least 3 months and after at least 25 ejaculations following the procedure. You must provide a semen sample at least 3 months and 25 ejaculations after your procedure to check for sperm. It is imperative that you use an alternate form of birth control until you hear from your surgeon that the procedure was successful based on the semen collection. If you did not use an alternate form of birth control during this time, you will be considered fertile and could experience an unwanted pregnancy. The lifetime failure rate of a vasectomy is 1 in 2,000. This means that once you wait the appropriate period of time and ejaculate all the sperm out of your tubes, and you have a semen analysis that is sterile, there is a 0.05% chance in your lifetime that sperm will return to your semen and make unwanted pregnancy possible again. Aside from the risk of vasectomy failure and unwanted pregnancy, there are a few additional risks. Approximately 1% of patients experience bleeding after the procedure, and in some of these cases, the patient needs to undergo additional procedures to address this problem. Infection can occur in the skin or deep inside the scrotum. This is typically managed with oral antibiotics. It is possible to develop chronic scrotal pain after a vasectomy, which is a condition called post-vasectomy pain syndrome. This is rare, occurring in approximately 1% of men after a procedure. A sperm granuloma can also form inside the scrotum after vasectomy. This is a benign, non-cancerous lump that can form deep inside the scrotum near the vasectomy site. This is normally the size of a pea and is not bothersome to most patients. The last risk of a vasectomy, as was discussed earlier, is regret, meaning wanting the procedure reversed. If you've not already scheduled a consultation with us, please reach out to our new patient coordinators to schedule an appointment either virtually or in person. We look forward to seeing you soon.